Good morning, Prep. This morning, we are excited to welcome Dr. Tyeese Gaines to speak about COVID and the Black community. Today's presentation is our last Black History Month assembly and connects nicely with our Arupe series on public health, which begins next week. There will be an opportunity at the end for questions. Dr. Tyeese Gaines is an emergency room physician who is a Jersey City native. She attended McNair Academic High School and is mom to Prep Junior Ellis Reed. After graduating from McNair, she got her bachelor's from Northeastern University in African American Studies and her master's in journalism from there as well. She went to medical school at Nova Southeastern University and did her ER residency training at Yale School of Medicine, where she was chief resident. She's juggled medicine alongside a news career for nearly 20 years, working for mostly NBC outlets, working as an associate producer, reporter, and health editor. She has practiced in ERs and urgent care centers throughout New Jersey, Connecticut, Rhode Island, and Illinois. Dr. Gaines previously served as medical director and chairman of her ER in Rhode Island, and she ran 2 urgent cares, one in Illinois and later one in New Jersey. She completed a Master of Business Administration from the University of North Carolina, Chapel Hill in 2017. Dr. Gaines, we are super excited to have you. We are super honored to have you here today, and we can't wait for you to tell us all about COVID and the Black community.
Thank you. And thank you for that introduction. And good morning, everyone. I'm going to share my screen. Sky, if I could just ask, do you have the ability to let me share the slides? Okay.
Okay, try it now. You should be able to.
Okay, perfect. All right, and I'm going to put it to presentation mode. All right, can you guys see my slides? Are we good to go? Perfect.
Yep, great.
So thank you for letting me talk to you guys about this topic. I know that you probably have COVID fatigue and you probably hear that word more than you probably hear your own name at this point. But I really want to take a deep dive into a couple of things because I know there's a lot of bits and pieces that are talked about. And I just want to focus on a couple of things that are important. So obviously our theme today is about COVID-19. Vaccines are the new hot topic, as well as the Black community, and it is Black History Month. So I'm going to start out by talking to you guys a little bit about some factoids, and then we can talk a little bit about some history as well. But I promise to not bore you to death. So coronavirus. First question is, do you guys know why it's called coronavirus? And I say that with the caveat that this is not our first coronavirus. Coronavirus is actually a family of viruses. And some of them just cause the common cold. So if you actually look at like your Lysol bottles before COVID, if you flip it on the back, it actually said that it kills coronaviruses. So COVID-19 in particular is not necessarily, or coronavirus, I should say, is not necessarily a new type of virus, but this one is when you hear them say novel, it's because it's a new version of it. But there's a reason why it was named coronavirus. And I know a lot of you guys have to take Latin at prep. So it's named coronavirus because corona, right, is Latin for crown. And so you guys have seen this picture everywhere, right? So the virion is the gray circle, and those, things that are sticking out from there, the red things are the spike proteins. And so some people describe that as looking like a crown. So that's where the concept of calling it coronavirus comes from. And the other coronaviruses look similar. And then COVID-19, so if you're ever on Jeopardy and you're asked this question and, the prize is like $1 million, remember me. But this is how they came up with the acronym of COVID-19. The CO is for corona, VI is for virus, D is for disease, and then 19 is for the year that the outbreak was first recognized. That was in China. So first, I want to talk to you guys just in general about how vaccines work, because I don't want to assume that everybody understands it, even though most of us get vaccines throughout our lives in order to go to school. Some of us get flu vaccines every year, but a lot of people don't actually understand how they work. And so since there's a lot of talk about the COVID-19 vaccine, I figure this would be a good time for us to talk about that. So the first thing we need to go over is what happens when somebody actually gets sick with something, either a virus, like coronavirus is a virus, but then you can also get sick from bacteria. So when we get sick with any germ, it invades our body and essentially multiplies in some way. So that's when we call an infection, right? When somebody says, oh, you're infected or you're sick, that's what's going on. And so that causes an illness that usually makes us feel crummy, right? So our immune system is rallying and playing a role in trying to fight out that infection. And that's when we get fever, chills, body aches, because in essence, that's the body trying to fight off that illness. So for some of these illnesses, we'll talk specifically about viruses. It takes about 2 weeks, and then the infection naturally leaves behind fighter cells that remember that germ. So that means if your body ever sees that germ again, so let's say you were sick 3 weeks ago, and now your classmate has the same virus and they cough in your direction, 9 times out of 10, you're not going to get sick again, because your body is going to say, oh, we saw this germ before, and be able to mount a response and then fight it off before it gets a chance to multiply, because the multiplying is what makes you sick, right? That's what gives you the infection. So there are some things that give you almost like lifetime, what we call immunity. I know you guys are hearing things about the immune system and antibodies. That's what that whole process is. So the same thing happens with the same concept is what we want to recreate when we talk about vaccines. So I like to think about vaccines as a dress rehearsal. So there's a lot of vaccines, they all work in different ways, but many vaccines have particles that look like the virus. Okay, so this is my photo of a dress rehearsal. Many vaccines have particles that look like the virus, but don't actually infect you, right? So we talked about the difference between what an infection actually means. So you're not going to actually get sick, but that doesn't mean you're not going to feel crummy, right? So in the case of the flu vaccine, for example, since that's a more common one, it's either dead virus in the shot or a very weakened form of the virus, but it still looks like a normal flu infection or a flu virus. So the body starts to create those same cells like it's fighting it off. So that's why sometimes you'll get body aches and stuffy nose, don't want to get out of bed, because your body is still kind of acting like it's fighting off the flu, even though you're not really at risk of developing the flu. So let's talk now about the COVID-19 vaccines that are out. So they work in 2 generally different ways, but same concept. If you just keep that concept in mind that I was talking about the dress rehearsal. So basically, one way that the vaccines are working is that, remember those spikes that I talked about? I'll actually go to the next slide quickly. So those red spikes, those are the spike proteins. So again, when the body sees the virus, it's going to have a response, right? So what they tried to do is say, okay, how can we produce something that looks like this particular coronavirus without actually making people sick, right? So they took a piece of that spike protein and put that into a vaccine so that when you inject it into someone, they still mount a response because that protein is still foreign, right? And the body goes, oh my goodness, there's an invader, let's fight it off. And then those memory cells stick around so that if it sees it again, it'll actually fight it off. And so instead of actually giving the entire coronavirus, because that would make someone sick, they just took a piece of the protein. So now when people's bodies who receive the vaccine see that protein, they'll be ready to fight. And then that virus will not be able to infect that person. That's the theory behind it. The other way, the other type of vaccine is where instead of essentially, and I'm really, breaking this down into layman's terms, it's obviously a little more complicated than this, but the other way is that they actually, instead of just like filling a vial full of those proteins, basically, they are injecting something that makes our own bodies produce that spike protein itself. So you don't have to actually inject that whole amount. You inject something that tells the body, hey, make those proteins, but then the body still has the same response. It goes, wait, there's weird things in our body. Let's mount a response and fight those off. So those are the two main ways that these two vaccines are working. And so just a couple myth busters, just to go back. So this is with any vaccine, but particular with COVID-19. So you cannot actually get the disease from the vaccine, but it is a process, right? So you don't just get your shots, even your regular measles, mumps, chickenpox, you don't just get the shot and then like, oh, I'm great. I don't have to take any precautions. It still takes 2 to 3 weeks for your body to make those antibodies and to make those fighter cells. So in that time period, you could still get sick. So if you are going to get it or someone is going to get it, make sure that they are staying safe in that time period. And then not all antibodies last forever. So if you ever, when you go to the pediatrician, you hear, oh, you have to get a booster shot. That booster shot is to kind of give you another little small dose of the vaccine because maybe it's been 10 years since your last one. So tetanus is a common example. We tend to give that every 10 years because those antibodies don't stick around in the blood forever. And so a lot of people complain, oh, I got the flu shot and it gave me the flu. Again, we've already established that can't happen. But what it does do, again, it causes a dress rehearsal. So it does everything that your body might do if you action, but it's not going to actually make you sick. You're not going to have long-term damage. It's just the body, the fever is trying to cook it so it can kill the virus. You might feel bad. You'll have a runny nose because again, the body's trying to make mucus to keep this foreign invader out of the body, right? It's all a fighting response. So in essence, it's almost a sign that it's working. Not everybody has that response. What we're seeing with the COVID-19 virus is that if people aren't having that response with the first vaccine, they tend to have it by the time they get the second vaccine, because at that point, they really have those fighter cells and they're ready to fight. So let's go back to talking about the virus itself. So who is at risk? You guys have probably heard a little bit too on the news about, oh, this person is high risk for COVID. You have to keep them safe. Older people, things like that. So this is the list from the CDC, So folks who have cancer because their immune systems are often not normal, people with kidney disease, lung disease, that mostly includes things like COPD and emphysema that smokers get. But there is some question about whether asthma is in this group or going to become listed in this group. People who have Down syndrome, certain heart conditions, a weak immune system, obesity. So that's a BMI of greater than 30. Pregnancy also, because pregnancy in general kind of weakens the immune system. People who have sickle cell disease, heavy smokers, and people who have diabetes. So this is the at-risk group, right? So the $1 million question is, and if you can answer, if you can ever, if you have future researchers out there, if you can answer this question, you will be a very successful person, is why are some people affected with this more than others? So even if you take this list that I just put up of people who are at risk, some of them get it and they feel fine, and some of them get it and they are in the intensive care unit hooked up to machines. And so that is some of the work that's going on right now, is to try to figure out why are some groups being more affected than others. And I think once we figure that out, we might actually be even closer to a treatment as we need it. And then the other question in lieu of, in light of our topic today, is why are people of color becoming sicker? And I'm sure you guys have also heard that on the news as well, that Black and Latino populations are being affected by this a lot more, even if they're not getting in as much as other populations, they're getting sicker and dying more of COVID-19. So there are some theories that we're starting to look at. But just the take home answer to this is that we don't really know exactly why this is happening. But some of the things that we're starting to look at are the fact that, for one, when everything shut down on March 13th, there are some people who still had to go to work. And so when you look at the workforce, more folks of color actually work in jobs that can never be done remotely. So they still had to show up. They're still essential workers. I think I just saw a stat yesterday that said, a third of nurses in some areas are Black or African-American, or identify as such. So, these are people that are, don't have an option to go into lockdown. And so that in and of itself is going to expose more people. And the second thing is the inability to access good healthcare. And so that could be because of simply access. There are some communities where there's just not enough physicians in that community. Maybe people don't have insurance, maybe they can't afford it. There's folks looking at the stress involved of a lifetime of experiencing racism and what that toll takes on the body. You may not have heard it now because you guys are young, but the adults that are in the room know that there's, a saying that like stress can kill you, right? Because it runs down your immune system. So this isn't really that unfathomable. And then, when you look at urban areas or people who live in dense areas, the percentages of those people of color who live in those areas are higher, right? So if you think about it, right, think about all the times that you are wearing your mask. You're wearing your mask when you go to the store, right? You're wearing your mask when you are in an enclosed room with other people. But when you go outside and you're in open air, you can take it off, right? So think about people who live in these high rises and they're on top of folks. And if they go for a walk outside, there's 30 people passing them in a few minutes. So when you have these denser areas, there's more of a chance to spread it. I mean, look at what happened in New York City. The other thing is that we're looking at is low vitamin D. So there definitely seems to be some connection. We're not completely sure what that connection is, but that we're looking at those who got sicker with COVID had lower levels of vitamin D. And so this affects people of color because if you don't know, you get vitamin D naturally when the sun hits your skin. So you can imagine, right? If you have darker skin, if you can tan really quickly in the sun, you're going to likely have lower levels of vitamin D because the whole reaction that has to happen in the skin, there's natural sunblock essentially blocking the sun trying to come in. So people of color statistically are usually lower in vitamin D. So that's another question. Is that why those populations are being affected more? And then underlying health issues. I mean, if you look at stats, diabetes, high blood pressure, people of color are overrepresented in those with those diseases. And so those diseases make you, we already looked, right, a couple of slides ago, those diseases make you more susceptible to being sicker with COVID. So, and then all of these things that we're talking about makes it even more important for those who are higher risk, like those conditions we put on the slide, as well as people of color to really heavily consider getting the vaccine. And I say consider it instead of just saying, absolutely must get it, because it's an individual choice. I understand that there are risks involved and people are nervous about it. But if you fall into those groups, it's definitely at least a good, solid conversation that needs to be had. So let's look at New Jersey for a little bit. 1.7 million doses of the COVID-19 vaccine of one of those two brands that are out right now have been given, which is just, I think it's amazing that this many have been given out in such a short time. It's not perfect. I'm sure we have a long way to go. It's like over 8 million people in the state. So, but we've gotten 1.7 million vaccinated. So, or at least 1.7 million doses. So the interesting thing about this and why I put up this slide is just for you to look at the ethnic racial breakdown of who has already received the vaccine. So the percentages on the left-hand side is what New Jersey is reporting as the racial makeup of those who have received it so far. The 16% unknown obviously leaves a big question mark because we don't know what bucket that 16% actually falls in. But the thing that I just wanted to kind of get you thinking about is that, in the state, we have 15% of people identify as Black. We have 20% that identify as Hispanic or Latinx. And you can see that there's only 4% and 5% right now that are being reported as having of those getting the vaccine that are Black and Hispanic Latinx. So could some of those 16% be Black and Hispanic Latinx? potentially. But even if you took that whole 16% and added it to the group, right? So there's 9% right now that are Black or Hispanic Latinx. Even if you added the whole group of 16%, you're still falling short of the fact that 35% of the state identifies as Black or Hispanic Latinx, right? So there's a discrepancy there. Whereas the percentage of the population that are of New Jersey anyway, that identify as white, non-Hispanic, is about half, 55%. And you see about half of those who've gotten the vaccine are also identifying as white. So it's more on par with what our population looks like. So just something, to look at. And I'm curious to see how these numbers will continue to trend over time. Obviously, they're not perfect numbers. But what I think the take home here is that we have certain populations that are not necessarily getting vaccinated as vigorously as others. And so the question really is why? There was a survey done in December that showed that African Americans were among the least likely to express comfort with the vaccine. So the question that they posed was something along the lines of, if a vaccine were to become available today, how likely would you definitely get that vaccine? And so among all the different groups, African Americans were the lowest. And I've seen numbers anywhere from 1/3 of folks surveyed, 1/3 of African Americans surveyed being very hesitant about it, up to 60%, right? So again, the question is, anytime you see data like this, or you see statistics about an entire group of people, the question is, your first question should always be, as young men who are learning and developing your worldview, is why is that happening? Why this group? Why not another group, right? And so some of the things that have come out of the surveys is that there are some African Americans that feel, oh, I don't want to be experimented on. There's some populations that are worried that they are not going to get the best quality vaccines, that the ones that they will receive are the bad ones. And this is not the first time that I even have heard this among certain populations over the last 20 years. I've heard this among people who have Medicaid, because it's income-based, it's based on your income. So they sometimes feel, oh, they're going to give us the bad versions of that vaccine, the throwaway version. So this is not the first time that these types of concerns have existed, but now they're rearing their heads again because of everything going on with COVID-19. So again, the question is, why is this happening? So I want, it's Black History Month. So we're going to talk a little bit about history. I want you to go back in time with me. That's what this little clock is. Sorry, my screen is shaking a little bit. And so the first point in history that I want to talk about is the Tuskegee experiment. And I have that in quotes because that's not actually the official title, but that's usually what we call it, at least in the lay public. And so, I want you guys to humor me for a second, and I want you to use your imagination for a second. So if you're looking at TV or your cell phone and doing other things while you're listening to this, I want your attention fully for a second. So I want you to imagine, right? Imagine that you're not feeling well. You're starting to have some funny symptoms. You're not really sure what's going on. Maybe nobody around you is sick either. So you're just like, why do I feel like this? Right. And so you go to the doctor because the doctor's supposed to tell you what's wrong, right? So the doctor checks you out. The doctor does blood work, and the doctor figures out that you actually have a disease that has a name, a disease that he is aware of. And it's one that actually you can pass to others, people that you care about, and one that could actually be deadly. But the doctor never actually tells you that, right? So he sees you in the office, he does blood tests, he has you come every week, but never actually tells you what's wrong with you. On top of that, he actually has the treatment to make it go away, but he never gives it to you. Instead, he wants to study you because he wants to see what actually happens if we let this disease go. I think it would be worth teaching future doctors of America to teach them, what will happen with this disease if you let it go for months or for years or for 20 years, right? And so maybe he wants to even publish that in a book. So again, in this scenario, this hypothetical situation, you have no idea of any of this, right? You're just a patient. You don't feel well. You go to the doctor. You trust the doctor because they did all this school and training. And even when you go to other doctors, so let's say you go to a different doctor in a couple of years, the first doctor you saw tells those other doctors not to tell you what disease you have, because again, they're studying it. And if they tell you what it is and they treat you, then that first doctor that's studying you will not be able to document all the horrible things that are going to happen to you because you have this disease, right? So, and you're in this study that you never signed up for. You don't even know that it exists. And again, you're just trying to figure out why you keep getting worse and worse and worse. And then you get to a point where you actually end up unknowingly spreading it to, say, your wife who lives with you in the house. And you start, forgetting things, and your behavior starts to change or going crazy, quote unquote, as people might say, because now the infection has spread to your brain. I know this sounds absolutely crazy, right? But the question first is, how would that make you feel, right? Imagine you go through this for 5 years. And then someone tells you, let's say a news story comes out, or somebody posted on, social media. That wasn't social media back then, but let's just say it's posted, and you find out that you were one of those people that had this disease this whole time, that had a treatment, and they chose not to give it to you. Now, fast forward a couple of years after that, let's say you have belly pain, and you're like, man, I want to know what's wrong with me. Do you really think that you're going to want to go to any doctor? Are you going to be able to trust any doctors at that point? If you manage to survive that disease that is actually deadly, and now you have another problem, how are you going to feel about walking into a doctor's office? Are you ever going to believe anything that they tell you? Are you going to believe that you're getting good care? Are you going to bring your children to the doctor at that point, now that you've already had this experience where they let you be sick for years and didn't treat you? So unfortunately, this scenario that I have you guys imagining actually happened to people. So this was the actual official government's title to this study. It was a Tuskegee study of untreated syphilis. Syphilis is the infection in the Negro male. Negro meaning at that time is what they called Black men. This study went on from 1932 all the way to 1972. So I know for you guys, you're young, and 1972 sounds like a really long time ago. But if some of you guys know how old your parents are, or know what years your parents were born, some of your parents were alive when this was happening. It was not that long ago. And so just think about how that might make you feel, and what types of ideas you might share with your children, your grandchildren, about whether or not you can trust doctors, particularly as a Black person, right? So the next story, we're going to go back a little further than 1970s. Let's go to the 1800s for a second. So James Marion Sims was a physician. He's considered the father of gynecology. And so gynecologists, OBGYNs, are people who deliver babies. He used to do painful surgeries without anesthesia or pain medicine on Black female slaves. So part of why he became the father of gynecology is that he perfected a lot of procedures that are done on women, even to this day, that have been handed on from doctor to doctor to doctor in training. So obviously, yes, there is some benefit, so to speak. But the way that he went about it was doing surgeries on the Black female slaves without their consent, without giving pain medicine, and ultimately perfected this technique. And when asked about giving them anesthesia or medicine for pain as he operated on them, he said, oh, no, that's not necessary. They don't need pain meds for this type of surgery. But ironically, once he perfected his technique and he went out into the community to then perform it on, at that time in his community was mostly white women, every single one of them received anesthesia and pain meds, right? So just something to think about. And the other thing that's interesting is that this was also happening at a time where these women, right, they basically were sacrificed for, this man to learn these techniques at a time where Black female slaves couldn't even go to these doctors, couldn't have these surgeries. Some of them died from these conditions, even though there was a treatment that was found on other women that looked like them, and they did not have access to that treatment. So again, just something to think about. And then the last example, last walk back into history that we'll take is to talk about something briefly called eugenics. So I need your imaginations again. We're going to walk through another scenario. So imagine, you guys are somewhere between 14 and 18, right? So imagine it's 10, 15 years from now, you're an adult, you're out in the world, you're working, you meet a nice woman, you guys fall in love, you get married, you decide that you want to start a family, right? After a year or two, you still don't have any children, and you don't know why you don't have any children. Obviously, you're upset about it. You're sad because you really wanted children with this woman. She goes to the doctor, and she finds out that she doesn't even have all of her female organs. And she never knew that she didn't have all of her female organs. And so maybe she remembers going to the doctor when she was younger, maybe a preteen or a teenager. She did have, some other type of procedure, but it wasn't a procedure to stop her from having children in the future. But that procedure was done. So that really happened. It really happened that women became adults, had medical procedures of different types where it was basically legal to do procedures on young women to not allow them to have children in the future. So why, right? I know that sounds so bizarre for me to say that. So certain states, and even the Supreme Court upheld what's called sterilizing until the 1970s. Again, we just talked about the 1970s not being that long ago. And for certain states, it was their way of keeping people that they deemed, quote, undesirable from reproducing. And so at that point, they considered anyone with disabilities, people who were prisoners, and racial minorities to be undesirable people. So they didn't want them reproducing and making more undesirable people. Crazy, right? What's even crazier is that there was a point in time where this got to the Supreme Court, and the Supreme Court actually stated, quote, 3 generations of imbeciles are enough, and allowed the state of Virginia to continue with this practice of sterilizing young women, teenagers, actually, I shouldn't even say young women, children, without their consent, without their parents' consent, and without them even knowing that this was happening to them. So in 2012, so it's almost 9 years ago, North Carolina actually apologized for this practice. And some of those women, again, it went up to the 1970s. Some of those women are still alive. They gave them money for their pain and suffering. Obviously, that doesn't take it away. But these people, these women who went through this, some of them are walking around right now. It could even be people that you guys know that went through this. So North Carolina, a couple of other states apologized because it was actually a real thing. And they apologized because someone decided to take that right away from them simply because of the color of their skin. Now, do I think that every Black family in this country knows about these stories? I don't. But what does linger from generation to generation is this just feeling of mistrust, this feeling of how do we know we're being treated fairly? How do we know we're getting the best care? How do we know they're telling us the truth? So if you ever do talk to folks that have that mistrust, I just wanted you guys to have a sense of some of the history behind it. But some things are still persisting to this day, unfortunately. So these 4 bullets, I'll go through each of them, but these are based on studies that all have happened in the last 10 to 15 years. The first one, there was a study done recently that showed that when doctors are treating pain for broken bones, so long bone fractures, which is basically like your lower leg, your arm, if it just completely broke, that when they looked at the doses of pain meds that patients were receiving, it was very clear. There's a stark difference in the amount that they were giving patients of color, particularly Black patients, and the amount of pain meds they were giving people who were not. And then likewise, believe it or not, there was a survey done of fourth-year medical students, as well as resident physicians. So after medical school, you go to residency, you're a doctor, but you're still in training. So they looked at doctors in training who are already doctors, okay, and fourth-year medical students. And they asked them, do Black patients feel pain the same way as everyone else? And a remarkable amount of them said they did not think that Black patients felt pain like everybody else. And there were other questions like about, do you feel like their skin is thicker than everyone else's? And it's all these beliefs and biases that, are happening. I mean, we all know, we all have biases, right? No one's free of bias. But it gets a little dicey when you have people who are caring for other people's health when they're carrying these biases. There's also been tons of studies and statistics looking at Black women dying in childbirth more than women of other races. And that's not just poor Black women. Those are physicians. Just in the last year, there was a Black female physician who died right after childbirth. So education doesn't protect you. Money doesn't protect you. Serena Williams went public about some of her complications that she had given birth. Beyonce did as well, expressing their frustration that, maybe their concerns weren't taken seriously. I mean, you can't get much more money than that, right? So money aside, education aside, even if you are actually a doctor yourself, there's just these systemic and underlying things that are keeping Black women from having the same outcomes as everyone else. And then just in general, there's tons of data that just show that patients of color often feel unheard. And that's not just because of language. If English is not your first language, it's across the board. And so the issue is that trust is very important. There were several studies actually looking at what happens when Black patients are treated by Black doctors. And they actually showed that they did better. They survived better. Their outcomes were better. So does that just mean that all Black doctors just give better care? No, I don't think that anyone believes that, but there's something else going on. There's something between, Black patients being able to trust their doctors. And I'm not saying that Black patients only trust Black doctors, but in this particular study, there's something else going on that allowed them. And these are people who had heart procedures, women that were delivering, babies that are born, when they're delivered by Black physicians, that the Black maternal mortality, which is the rate at which Black women are dying in childbirth, got better, right? So we don't have all the answers as to why all this is happening exactly and how we can fix it. But one thing is clear is that health is not just science, right? There are many other factors involved. Mind, body, spirit. Sometimes you hear people say that, right? So if you trust your doctor, you're probably going to be more likely to do what they say. If your doctor is taking time to listen to you, then your care is going to be more customized to what you actually need. So, whether or not we can identify our biases is very important. So even if you have no interest in becoming a doctor or nurse or working in healthcare at all, one thing I do want to leave you guys with is that it is so important for you yourself in your job and whatever you're doing in your life to know when you're functioning within your bias. And what do I mean by that? I mean, know when these biases, whether known or even unknown, get better at identifying when those things are popping into your brain and how those might be affecting your decisions or how you're treating another group of people. So, we all hear things about different groups or about women versus men, or men always do this and women always do this, and all these other biases that we have, right? And so you have to really, for yourself, figure out, how am I allowing those beliefs to change how I treat people or the decisions that I make? Because if you do that, you could really help someone. Even if you're not the doctor in the operating room, or you're not the person that's taking care of that patient, just in society alone, you could help someone if you could recognize your biases as well as your neighbor's biases, because you can call them out on it and say, hey, maybe that's not a good idea, or maybe you should consider or look at things a little bit differently. I think in general, we would get a lot further. And you guys are all smart young men. You're at the point in your lives, like I said, that you're forming your worldview. So just something I would love for you guys to keep in mind. And so the other reason why this is important is because health is also not in a vacuum. I think COVID-19 was a perfect example of that, right? What happens to one group of people eventually is going to somehow affect all of us. Health is universal, right? Whether you have money or not, whether you have education or not, whether you're male, female, pink, green, blue, whatever you are, you have health. You can have good health, you can have bad health. And disease is going to come. And eventually everyone is affected by disease. So when these injustices happen to folks, it's society's problem. It's not just one group's problem, right? So the fact that we have groups that are afraid to get vaccinated, guess what? That affects all of us, right? The longer it takes for us to convince everyone to do what they need to do to prevent the spread of different diseases, and to trust the system in order to do that, the more it's going to spread, and eventually it's going to hit you guys. It's going to be somewhere in your circle, or at least affect your day-to-day life. So it is all of our problems. So because of this, and because we understand, some of the historical stuff, and by we, I mean doctors, in particular Black physicians, a lot of physicians in general are taking to social media, getting their shots on, taking pictures of themselves, getting their vaccines. I'm sure you guys have seen some of them. There's a hashtag going around called #ThisIsOurShot. And a lot of Black physicians are doing it as well to try to show that, look, it's okay. It's safe. We're even doing it. You can trust it. Because if you don't see people that look like you, especially if you're already nervous getting the vaccine, you're definitely going to be less likely to get it. And that the surveys already show that. So this is a friend of mine, Dr. Knight, who put both his first shot and his second shot on. A lot of doctors are putting, I got a fever, I was sick for a couple of days, just to give people an idea and to almost demystify this whole process, to make it not as scary. Like, look, yes, I got the shot. I felt sick. I got better. It's going to be okay. And just really trying to get people to feel comfortable. So these are some of the things that we are trying to get out. The word that we're trying to get out is that, yes, I know there's a lot of talk about, oh, the vaccine came out so fast. It came out so fast. The vaccines did go through rigorous testing. And the thing that's interesting about this, and I admit that I was initially skeptical until I started to do my own research and figure out, what processes were actually taken to make this vaccine. And what's interesting is that this is not actually a brand new vaccine. When you'll hear coronavirus, but sometimes you hear SARS virus, right? Because that's another name for some of the coronaviruses. When SARS happened some years ago, the technology behind this vaccine was created even back then, because they knew that we were going to get another pandemic similar to the SARS outbreak that happened some years ago. It just didn't ravage us the way that this one has. And so they already created the technology. All they needed to do was take the specific, remember we talked about those spikes, the crown, take that specific protein and add it to this technology. So they didn't just start from a blank canvas and go, oh man, we have this pandemic, we have to create a vaccine. The technology behind it was already there. They just needed to customize it with that one ingredient. So when I started to understand that, I definitely felt less skeptical about it, and learning just about all the testing that went into getting these vaccines to the market. And we talk a lot about diversity in research, and a lot of times we have entire studies where we don't really have a real showing of Black patients in those trials. And Black patients actually were included in these trials. It was about 10%. So it's not perfect, but that's still way more than we've seen in a lot of other research studies. So we know what the vaccine will do, at least in the short term, amongst a lot of different cultures, a lot of different ethnicities. Again, it's not a new vaccine, but what we do know is that COVID-19 can have life-threatening complications, even in people who had no symptoms. So even people who got it and never had a fever, never even knew they had it, we're finding that 6 months later, 7 months later, they're having heart and lung issues. There was a study that looked at college athletes that got COVID-19, and now they can't run as fast. They're getting winded, right? So getting the vaccine is important because it can slow down the spread of COVID, and it can protect not just you, but also your family members. Maybe you have a family member that has cancer or has lung disease. Maybe they can't get the vaccine for some reason, or maybe you have a baby sister or baby brother at home that can't get the vaccine, but you getting the vaccine or people around that person getting the vaccine can keep them safe. So the take home that I want you guys to take, aside from all the other points, is when you hear statistics about a group of people doing this or doing that, before you start saying like, oh, they never do this, or why won't they go to the doctor, or why do they keep getting sick? Why do they keep getting this disease more than other people? And start to blame the group of people. Ask yourself why. What's behind it? Why don't they trust? Why aren't they going to the doctor? Because I think if you start looking at some of these things that you hear in the news or these statistics in that way, I think we'll get to a solution even quicker. So don't get frustrated with it. Definitely try to have empathy. Definitely do not blame the group that's already traumatized, at least historically, and a little, some in the present as well. But really try to understand why people are fearful, why people are doing certain things, because that's the only way that we're going to be able to come together and solve some of these issues. And then again, like the doctors that are getting their vaccines on social media, lead by example, right? So I will stop there. And if you guys have any questions, I'm not sure how you guys are going to moderate the questions, but I'm happy to take questions that you guys have.
Yeah, definitely. Let's, if you have questions, why don't you pop them in the Q&A box and we will take a look. And Dr. Gaines, do you want to stop sharing your screen?
Yep. Let me do that.
Okay, perfect.
Awesome.
All right. Okay. I think we actually had one during your presentation. So let me just, okay, this has some medical words in it that I might mispronounce. I apologize in advance. There's a broad fear of adjuvants, aluminum compounds, and preservatives in vaccines. Can you alleviate these concerns?
That is a good question. I wish we were live because I actually have some questions. My question is the fear. So it depends on which fear we're talking about, because there historically has been a fear of certain aspect, like certain ingredients in vaccines, particularly with respect to children and autism. And that, that is a terrible falsehood that will not die, unfortunately. So just another quick history flashback. So long ago, not that long ago, but long enough ago, there was a researcher that published research that linked certain ingredients in vaccines, or just vaccines in general, to why children were developing autism more, so to speak, than they were before. And that same person was actually found to be a fraud, lost his position, lost his job. He basically was just trying to become famous. This is before social media existed. He wanted to make a career off of something, and that's what he made his career on. It's been long disproven in multiple other studies. It's almost like this, right? If you imagine today, I wanted to become a famous researcher, and I said, man, all these people are getting COVID. I wonder why they're all getting COVID. What do they all have in common? Oh, they all drink water. It must be the water, right? I mean, I know that I'm kind of exaggerating, but that's in essence what he did, right? Because if you actually look at the numbers of people who have gotten vaccines over the course of their lives, there are way more people who have gotten vaccines and been totally fine than the amount of people who have developed autism after receiving vaccines in childhood, right? And so, there are a lot of the vaccines that we get as children have been around for tens and tens and tens of years. We actually know more about those than the antibiotics that you guys take when you have strep throat, to be honest with you, because a lot of those are actually newer than these vaccines that we're getting as children. So just to give you perspective, so there's not many things in medicine that we've studied for 50, 60, 70 years. And in those 50, 60, 70 years, all of those people did not get autism, right? So he basically took the low-hanging fruit and said, aha, it's the vaccines. And no one else was ever able to reproduce what he found. And he was, was basically a fraud. I think he actually admitted it to some degree, but it's one of those things that just won't die. Okay. So I say that to say, if that's where this question is coming from, I just want to give you that history, because the fear in and of itself came from a place that wasn't even factual. So yes, we don't know. I'm being perfectly honest. We don't know what will happen in 20 years. But we do know what COVID is doing now. And we do know that 20 years from now, there's a good chance that a lot of people are going to have lung and heart issues from what COVID is doing to them. The people are having strokes with long lasting effects as well. So I'll pause there. But in this particular case, so far, I haven't seen that is an issue with this vaccine. But I just wanted to say that the fear in and of itself comes from a place that's rooted in someone just trying to make his career and scaring people, unfortunately.
I did not know that. That is very interesting and upsetting.
It is upsetting.
Okay, we've got a few questions.
Okay.
Let's see here. Will the vaccine being like the flu hold on. I'll read it out and then will the vaccine being like the flu vaccine, will it be like the flu vaccine as okay, got it. So the flu vaccine, pretty like a lot of people get it every year. Mm-hmm. They have it you can get it at your job or, when you go to the doctor's office. And this student is wondering if the COVID vaccine will ever be like that, if you'll just sort of get it,
Yeah, that's one of the things that we are talking about is whether or not. So let me give you a little background. So the reason why we get a flu shot every year is not necessarily because you're not having lifetime antibodies. It's because the virus itself changes every season. And so the reason why sometimes you might, let's say you got a flu shot last year, but you forgot to get it this year, but you didn't get sick. Sometimes they can still, remember we said, if it looks like the vaccine, the virus, you can still get some fighter cells. So sometimes it changes, but it doesn't change so much that it's unrecognizable and the immune system can still fight it from year to year. So there are some years where even if it's not exact, it still gives your body enough of a boost to still fight it off so you don't end up in the hospital. So I say that to say, this particular virus, COVID-19, we've already seen it starting to mutate and change. You probably have heard that word on the news that it's mutating. So it's changing. So we are talking about that, whether this will become something where we're having to give an annual vaccine to folks to kind of stay up with the changes that the vaccine is doing. We don't know the answer to that completely yet, but that is something that we are wondering if that's going to happen. And we also don't know how long exactly these fighter cells will stick around, right? People who got COVID in March, April of last year, by the fall, didn't even have antibodies anymore. So, which is why it's still important, even if people got COVID, to also still get the vaccine if that's something they're concerned about, because we know that they're not lasting forever. So time is going to tell. Time is going to tell to see when people, the folks that are in the trial, are they still showing antibodies a year from now, 5 years from now? And then how much the virus is changing. So the one thing we do know is this first mutation seems to be still covered by the vaccine so far.
Okay. Let's see here. In your opinion, what is the best way to fight the vaccine hesitancy in the Black community?
So I think there's a lot of grassroots efforts, like I said, of Black physicians getting out there and showing their faces on camera and talking about the concerns. So I think that's the first step, is for people to have faces that look like theirs, that they can trust, giving them facts. I think there's a lot of bad information out there about health in general, let alone this. So I think the first thing is myth busting and getting facts out instead of just information that makes everybody nervous and scared. And then I think the second thing is just, like I said earlier on the slide, is for physicians, even if they're not physicians of color, to have empathy instead of getting frustrated, like, why won't you get the COVID shot? Don't you know how important it is? Try to understand what the fears are and not just jam things down people's throat, but to actually ask them, what is it that you're nervous about? Because sometimes the things that they're nervous about are clearly factually wrong, right? And so if it's something that we don't know the answer to, then we just don't know the answer. But sometimes the fears are rooted in things that you can easily disprove. So it's really just about having the conversation and actually just asking people, why are you hesitant? What are you afraid of? And then, I know a lot of my friends that are Black physicians are, telling their patients, look, I got it. I got it a month ago. I got it 2 months ago. Look, I'm still here, still have all my fingers and toes. And it makes them feel more comfortable to know someone personally who has gotten it. So I think it's going to be hitting it from a lot of different angles, but it's just really getting the word out and finding out where the fear is actually rooted. And you can't assume that everybody's fearful because it's Tuskegee. It could be something totally different. So we have to have that conversation. And I actually see below that, there's a question about this, like similar with the Latino community. Yes, we are seeing that there is some nervousness as well about vaccines in the Latin community as well. Obviously for different reasons, because obviously those, the things I mentioned in history were just focused on African Americans, but there is a similar hesitancy when you look at statistics among the Latin community as well. And I think the same approach is what we need to do. I think we need to understand, we can't assume, both communities are nervous about the same thing. I think we need to ask folks why they're nervous and address those things one by one, which takes time, but that's what we need to do. I think it would be great if we had more celebrities or all these people who pretend to be influencers, even though they don't do a whole lot in society. This would be a great time for them to use their platforms to start to, and I'm not saying they have to jam, go get the shot down people's throats, but just to address the questions and just to address the fear and open up a dialogue about it.
That's such a great answer. Thank you so much. We're actually seeing quite a few questions, which is great. Ms. Dallin, do you see any that you want to ask? I'm not sure we can do all of them.
While you guys are looking, can I answer one that I just saw that I'm trying to keep up?
Yeah.
There's one that asks, if you have antibodies before getting the vaccine and then you get the vaccine, will the new antibodies and the old ones clash? So I think that's a great question. And the question is, will it cause a negative reaction? It won't. It's almost the same thing as if you get one vaccine and then you get the second vaccine, right? Because people are getting 2 vaccines. So when you get the second vaccine, you already technically have antibodies in your system, and those 2 things don't clash, right? So it just kind of boosts it. Same thing with booster shots, like I mentioned, for tetanus, things like that. Some people even need a booster for measles, mumps, and rubella sometimes because it disappears from their system. So that it does not necessarily clash. No, it just adds to it. However, what I will say is, and this is, don't hold me to this because it hasn't been published anywhere, but what we're kind of anecdotally seeing is that people who did have COVID already, like naturally got COVID, when they get their first shot, they're getting the fever and the chills more on the first shot. Whereas people who didn't get it before, we're seeing them sicker on the second shot, right? And that makes sense because you already have more of the antibodies.
These are some really good questions. I wish we could get to all of them. Let me see. Here's one. My parents are not really worried about the short-term side effects of the COVID-19 vaccines. However, they are quite afraid of the long-term effects, which is why they are hesitant to take it. Are you able to explain the long-term side effects, 5 to 10 years of consuming a dosage of the COVID-19 vaccine?
That's absolutely, that's a great question. We don't know, right? Because with COVID-19 hasn't even been around that long for us to even know what's going to happen in 5 to 10 years. And it's a valid question. It's a valid concern. The way that we talk about it. And by we, again, I mean like my colleagues who are particularly Black physicians, we will sit around and we'll talk about this and, what message do we want to get out to folks? Do we, what if something can happen later? But again, everything that we do in medicine is a risk and a benefit, right? If you've ever looked at a prescription for a medicine that maybe you've taken or your parents have taken, there's like all of these things that the medicine may cause, right? You hear them on the commercials, like, oh, take this medicine for your congestion, but it may give you headaches and may make you stay up all night, right? There's always risk and benefits. There's always side effects to things. What you have to do is figure out, do the risks of the unknown outweigh the benefits of getting the vaccine, right? And so some of the things that we do know is like I said, that COVID-19 so far, even people who never had any symptoms while they were infected, that is a good chunk of people who are having long-term effects so far, and obviously not 5 years, but at least a year. I mean, I have colleagues in the ER who got it early on, who still have symptoms, who still get winded when they try to walk upstairs, who still feel the like stroke-like symptoms that they had when they had COVID and they were in the hospital, right? So we know right now that COVID is doing things that last way beyond the 2 weeks of infection. So again, it's the risk and the benefit. So I don't have a great answer for that because obviously I can't see in the future. And it's something that we are talking about, and it is a risk. I mean, but it's also a risk to just let yourself get COVID-19. And then what will it be like trying to walk upstairs for those people 10 years from now, right? We don't know that either. And so it's looking at the risk and the benefit. I mean, from what we can tell, based on other vaccines that are made similarly to this one, there's a very low likelihood that we'll see some crazy thing, develop, like you see in the movies. And I've seen a lot of memes and jokes about that. It's very unlikely that will happen, just looking at other vaccines that operate the same way as this vaccine does. Again, then the one nice thing is that it's not completely made from scratch. So we do have some history to go off of, but it's not exactly specific to this one. So the answer really is we don't 100% know. But again, I think as folks are making their decisions, they have to look at what we do know and what damage COVID-19 can do even now, and weighing that with the question of what could happen later. But so far, a lot, like I said, a lot of the other vaccines that use the same technology have not seen long-lasting issues. Any other ones you guys want me to jump on?
I think this last one is, I don't know if you have an answer for this, but so distribution of the vaccine has seemingly become extremely convoluted. Who gets the vaccine has become a question of who do you know rather than who needs it. How exactly do we solve the issue of unfair distribution?
Yeah. Yeah, you're right. I don't have a solution for that. What I will say though is, depending on who's in charge of it in your particular town, city, community, state, I mean, it's hard because it's happening in real time right now, but I think that we as citizens have a lot more power sometimes than we think that we do. The people that are in power are there because we put them there, whether by our vote or whether by being, appointed by somebody that we voted in. So I think that, it doesn't work every time, no, but I think that we have to be vocal. If you see these things happening, if you see that your community is not getting this or that we need to be vocal and we need to, express our displeasure about that to folks that can actually make a difference, because re-election will happen and they care about their constituents. That's probably the most power that we have right now. I think that a lot of states are trying, all of this is brand new, right? This all came out of nowhere, and we're just trying to do the best that we can. So I agree with you. I have been hearing reports that, some people are trying to get it, they can't. Then there's some areas that have too many. And, so my optimism is that we will figure this out, but it's just, we're going really fast, and we're trying to get it out, sometimes in some states before the processes are made. So it's not going to be perfect. My hope is that we will figure it out as we go. But I think that in your particular town and your particular state, or, you know, where most of us are in New Jersey, I think the key is to speaking to your locally elected people and seeing what pull they have to make things more fair for certain areas. I did also just stop on one question about, do you think that in medical journals and books that Black people are underrepresented? And I think that might be a good, I don't know how much time we have, but that might be a good thing to start to wrap up on, because it kind of ties into a lot of what was in my presentation. So I absolutely think that that is the case. We again, as the physician community, have been pushing for diversity in medical research for quite some time, which is why I was actually excited to see that 10% of those in the COVID-19 trials were Black. There have been whole studies on drugs and different things where there really was not representation from people of African descent. And, you know, why is that important, right? You might say, well, why is it important? People are people. I'll give you a couple of examples. So this actually happened while I was in medical school. There was a common blood pressure medicine that used to be given to people who had high blood pressure. And it seemed like what they assumed was that a lot of the Black patients were not taking their medicine because they kept coming in, their blood pressure was still high. Oh, they're not taking the medicine, Why aren't they taking the medicine? Their blood pressure is still high. And the patients were like, no, I'm taking it. And it took someone to finally take a look at that medicine and actually study it in African Americans, and saw that that medicine just was not effective for people of African descent, and that they needed a whole different type of medicine to bring their blood pressure down. They switched a lot of those people from that first medicine to the second medicine. All of a sudden their blood pressures were normal, right? So how would you have ever known that if you didn't have any people of African descent in those studies when you first rolled out that new medicine, right? You wouldn't have known that it wasn't working in that group of people. And we've seen that with certain medications and certain responses to medicines in Asian American communities, Black communities. Like we've seen this over years. But sometimes it's not only on the researcher, but it's also on the patients, because if there's this mistrust already that you're going to experiment on people, you're not going to have that group of people readily sign up to literally, you know, be a part of the study and be part of an experiment. So we have to deal with that aspect of it to get more people into some of these studies. But I do think, yes, that we have done a lot of studies over the history of medicine that did not adequately look at enough people of color in general and how we might react differently. I'll give you one other example of this. There was some recent data I was looking at like last year where they looked at women with breast cancer, and they took away income. So women who made the same amount of money, same level of education, same doctors, same affluent communities, the Black women were still dying more, even though they were getting the same exact treatment as the white women in the study. And so it begs the same question. Is it that those medicines just don't work in all women, and we don't know that because those women weren't in the studies? I think that's a great question. I think it's something that we have to figure out how to solve, because there are biological differences, right? We all look different. There are some genetic differences with people who come from different areas of this world. And what does that mean for medicines? What does that mean for treatment? What does that mean for vaccines? I think it's a very valid question, and something that we are going to need to solve if we're going to make sure that everybody stays healthy.
Thank you so much, Dr. Gaines. This was like just so informative, and so, so much information that many people are not aware of. So we just want to thank you again. Also to the students, of course. Also to the students, we do have, the science department was also involved in this. So if you do have any questions that may arise when you're in class, or, you can always go to our science department and, continue the conversation with them as well. I'd like to hand it over to Mr. Doherty now. He's going to lead us in our examen. And I just want to thank you again, Dr. Gaines. Thank you for your time.
Thank you guys for your attention and for the great questions too.
All right. Thank you again, Dr. Gaines. That was really phenomenal. Thank you so much for being here today. And thank you guys for your attention and for your great questions. I was flipping through the questions as well. Some really, really wonderful thoughts. So we are going to close as we usually do with an examine. As Dr. Gaines was talking about, and as kind of came across in the presentation, when we talk about racism, we talk about racial injustice, we're talking about a structural reality. We're talking about something that really kind of permeates, every part of our society. It's something that's woven into our history, is in the air we breathe in a lot of ways. Sometimes we talk about it in the context of people's attitudes or people's opinions, people's perspectives. And while that's an important part of kind of combating bias, we also need to be aware of these structural realities. The church calls this social sin, the idea that there are sins that we perform ourselves and there are sins that society performs that we might take part in even if we don't realize we're doing it. So today's examine is going to look at racism and racial injustice in that same way. It's going to challenge all of us to just kind of reflect on what our relationship with racial justice has been. When are the times where we have stood up for something that's right? When are the times that we haven't? So I'm going to invite you as we begin this examine just to try to let go of any distractions, maybe, flip your phone over, push it away from you, try to get comfortable, not so comfortable that you fall asleep, and try to open your mind and open your heart to what's going to happen in this prayer. I think that's the first thing that we need in any examine and really any encounter with God or with one another is an openness of mind and heart, the ability to step outside of ourselves, to maybe look at things a little bit differently. So take just a moment now, calm yourself, quiet yourself. Take a few nice deep breaths. Let's begin by becoming aware of God's presence. Think about the God of the oppressed, the true and loving God. Think about the people that God called God's own. Remember that the people God sought to protect, the people that God pulled profits from, were the poor and marginalized of society. And as you do that, reflect on the poor and marginalized of today's society, the people who are left out, the people who are pushed to the edges. Who do you see? Remember God's love for them by seeing them, and how we are all called into God's love by loving them and resisting the systems, thoughts, and institutions that seek to prevent love and community. Remember that there is no room for love in racism. Next, I want to invite you into reflection and reflect on your own relationship with racial justice. As I said before, racism is what the church calls a social sin, an evil woven into the very fabric of our society. It touches our lives in ways that we may not even notice. In order to become aware, we must ask ourselves some difficult but important questions. Have I fully loved God and fully loved my neighbor as myself? Have I caused pain to others by my actions or my words that offended my brother or my sister? Have I done enough to inform myself about the sin of racism, its roots, and its historical and contemporary manifestations? Have I opened my heart to see how unequal access to economic opportunity, jobs, housing, education, and as we discussed today, healthcare on the basis of skin color, race, or ethnicity has denied and continues to deny the equal dignity of others? Have I ever witnessed an occasion when someone fell victim to personal, institutional, systematic, or social racism, and I did or said nothing, leaving the person to address their pain alone? Or was there a time where I was the one who inflicted that pain, acting the opposite of God's love and the love of neighbor? On the other hand, have I ever lifted up and aided a person who fell victim to personal, institutional, systematic, or social racism, and paid a price for extending mercy to the other? How did I react? Did my faith grow? Am I willing to grow even more in faith through my actions? Next, I want you to pay attention to your emotions. This is something that St. Ignatius said was very important because God can speak to us through the movements of our heart. That was how he understood our emotions. So in reflecting on your relationship on racial justice, with racial justice, what are your feelings? Is there shame, anger, discomfort, fear, or even hatred? Are there hurts that you've kept to yourself? Memories that you try to keep buried? Are there prejudices you hold that you are becoming aware of? Are there moments where you feel confused, not sure whether something you said, did, or heard was problematic or oppressive? However uncomfortable it might be, I invite you to sit with the discomfort. Lean into it. We only grow by going beyond our comfort zones and looking at the world in a new way. So don't push your emotions away. Instead, allow yourself to feel them. Take a few moments now just to discuss whatever it is that you're feeling with God in the quiet of your heart. Finally, let's look forward to tomorrow. Reflect on the ways that you can help create a more just world. Are there social justice groups or organizations that you can join or give support to? Are there books, articles, or other forms of media on race that you can turn to for education? Are there friends or strangers who need your support? Is there a wound that needs healing, either within you or caused by you? take some time to make a resolution for the future, a concrete way that you want to put your faith into action by working for justice. As you do, ask God for whatever grace you need moving forward. Maybe it's courage or openness, humility, strength, healing, forgiveness, or hope. Whatever it is, bring your needs to God, confident that God hears them. We'll just take a moment to do that. So we're going to close now with a prayer for racial justice shared by the Association of Jesuit Colleges and Universities. Let's begin as we always do. In the name of the Father, Son, Holy Spirit. Amen. When we do not see the gravity of racial injustice, shake us from our slumber and open our eyes. When out of fear we are frozen into inaction, give us a spirit of bravery. When we try our best but say the wrong things, give us a spirit of humility. When the chaos of our current moment dies down, give us a lasting spirit of solidarity. When it becomes easier to point fingers outward, help us to examine our own hearts. God of truth, in your wisdom, enlighten us. God of love, in your mercy, forgive us. God of hope, in your kindness, heal us. Creator of all people, in your generosity, guide us. Racism breaks your heart. Break our hearts for what breaks yours. Amen. St. Ignatius of Loyola, St. Peter, thank you very much for listening, for your attention. I hope you got something out of this time of prayer and reflection. Before I finish up, I just wanted to remind everybody that next week is the beginning of our Rupe series on faith and justice, as Ms. Dallin mentioned at the very beginning. It's going to focus on public health, specifically the COVID-19 pandemic. So obviously, Dr. Gaines' wonderful presentation today has a lot of great tie-ins to what we'll be talking about all through next month. So if this really got you going, if you're really excited and passionate about this, and this is an issue that you want to learn more about and respond to, you're about to have a wonderful opportunity to dig a little bit deeper as well. You had the chance to register last week. Your registration will be shared with you by the end of this week. So if you haven't received one yet, don't worry. Nobody else has either. You're all good. We are just processing them. We should have them out either by tomorrow or Friday. Thank you very much again for your attention. We're looking forward to examining how our faith calls us to respond to this urgent issue together. And I will turn it back over to Ms. Dallin and Ms. Friedlander to close us up.
Thank you so much, everybody, for your participation. Have a wonderful day.